So, everyone, welcome to today's special edition of Inner Horizons with Rishi Khatri. And we have a very special guest on today's Christmas Day, Dr. Kathryn Mazza, DO. And, thank you so much for joining me. And I can't wait just to talk about what you do. If you can give us in a nutshell more about what you do, I would love to hear that.
My pleasure. Thank you for having me. I am a board certified family medicine physician. I have a subspecialty in osteopathic manipulative medicine, and I have a large focus in mental emotional health, female health, and I try my best to do more integrative medicine and including options for people for typical treatments that would most likely be in medical or pharmaceutical. I attempt to do things more holistically with supplements and other lifestyle changes.
That's awesome. I mean, we need more of that in this world. So one of the questions I have is, I've met lots of osteopathic physicians and allopathic physicians. So what drew you to osteopathic medicine? And when did you realize it was more than a degree? It was more, well, it had a lot of philosophy in it as well.
Yeah, that's a great question. But the answer really, I wasn't attracted to osteopathy at all. It was more, to be transparent, I have learning disabilities and I had difficulty doing exams. I had difficulty getting to class and doing all these things. So like I ended up at a DO school, which I'm really, really grateful for because it aligned with who I was and how I think about people because I didn't actually want to I didn't like doctors when I was growing up. I didn't want to be a doctor. I thought medicine was only about quantitative and the quality of life wasn't being taken into account. And so when I was accepted into a DO school, I was really grateful. They approach patients from a mind, body, spirit. This is not looking at somebody, they have a symptom, we're going to treat the symptom. We're going to actually look at the whole person. Who are they? What do they do? What are they feeling? And how can we help them? So I found this to be really lovely. In addition to, we can treat people with our hands. And I was just like, oh, yes. And I love this because I had difficulty in school. I am not an A student, just FYI. And, I had to learn how to fail and I had to learn how to get back up in med school. What really spoke to me during med school was this osteopathic manipulative medicine where it's just like, it was just going from here to here. And being able to treat somebody's pain, being able to treat somebody's migraine, headache, carpal tunnel, everything like that, like that was amazing. Like, I can help people get over their colds faster than, I'm not treating somebody's symptom. I'm actually treating their cold and treating long haul COVID. Some of my teachers going to yell at me for saying this. It feels like magic. But it really does because I'm just sitting there with my hands helping your body come back to center. And I think that's the most beautiful thing about being a DO.
Well, I love the fact that you said that we many times providers will treat the symptoms rather than treating the disease, and that is something I have found problematic, and it's hopefully will change. And I think that when more people turn into different approaches rather than just the one approach that we're given a lot of times. And I
Right.
also like the fact that you talk about the mind, body, and spirit. And which one of these do you think that modern medicine still struggles to most genuinely honor? And we talked about it before, like just FYI for all the listeners, the recording glitched, but I want to hear it again.
I think I still have the same answer. And it's that I think all of them still need attention. And like, we're missing the mind, body, and spirit of medicine. It has become like a pharmaceutical turnaround. Like, here's medicine, do this, do that. Where like there's no motive, like we don't have time. I mean, this is a whole like we're not going to go into this like what's wrong with the industry, but I feel like giving people's attention to their body, like what's going on with your body? Why do you have this shoulder pain? It wasn't trauma. Like, here's some exercise. Here's this. My patients get confused because I'm offering them OMM and I'm offering them exercises and they're genuinely just like looking at me like, "Oh, what?" And they come back and they're like, "Oh, I feel better." I was like, "Yeah, that's great." So like that's the physical, the emotional. I approach patients through their emotions, because people with chronic issues have chronic issues for a reason. It's socioeconomic, it's mental emotional health. It is, it can be cultural, it can be from their family and genetics, it can be from exposure. So it's like you have to take all these like parts of a person for them to start understanding themselves. People don't understand themselves. You actually have to actively learn how to to know yourself. And so that's another thing I start working with patients. I was like, why do you do this? Why? And promoting self-reflection and coming into, that's, mind and emotions. And then coming into the spirit. I mean, who uses that? Nobody really. And I find internal reflection, understanding your internal world is what's going to actually bring you into wholeness. When people don't actually know what's going on here and there's not a connection from here to here, people are lost. I've been lost. Still a little bit lost, but the road from here to here is the hardest road, right? And offering patients things that they can start doing on their own. I work in a lot of federally qualified home community centers, and people don't have money. So I give them I was like, you have YouTube, you have a cell phone. So I give them things at home that they can really start coming inside of themselves. A lot of people talk to God, but do you talk to yourself? I'm not religious, but I'm just like, what about people go outwards? They're talking to God there. I was like, what if you thought God wasn't here? If you are God. And so people they're like, so just kind of flipping the perspective of it all. And I think the more people start understanding how special they are, the more they start treating themselves with the same reverence that they treat other people.
Mm.
And that's when I start seeing people change, doing the things for the love of themselves.
Wow. I mean, that is, you've given me a different perspective already. And yes, like a lot of us don't know ourselves. And part of what I was thinking about why it's the way it is because perhaps you mentioned the word industry, right? And so when your product becomes sickness, what do you want to produce more of?
Mhm.
If you need people to be sick for your industry to work, then why would you get rid of your product? And so that's something that's came to mind when you were mentioning the why. And in terms of the overall life, and so from where I come from in my background, because I work in mental health primarily now, it's what's the purpose of life if not to enjoy life, right? It's not just to be healthy, but if you don't know what you're doing in life or how to experience this beautiful world of ours, then what's the point? And so people just don't really understand it. And they're programmed by many things to do things. But I love your answer. I'll actually reflect upon that later on. So another question we did hit on before, and we didn't get into it. How has yoga philosophy influenced the way that you approach healing and illness?
Can you say that one more time and cut off a little bit?
Yeah, yoga philosophy talks a lot about awareness.
Mhm.
So, awareness of the relationship to the body, not just movement. How has yoga philosophy influenced the way that you approach healing or illness?
I think the biggest thing I've learned from yoga is there's a few things. I'm laughing because I'm thinking, so I met my cousin, my second cousin in residency, one that I've never met before in my life. And we connected, we actually figured out we're second cousins, and it was wild. We ended up at the same residency. She was doing OMM, NMM, and I was doing FP, OMM. Like, I think she was realizing how miserable I was. And this is when I really didn't know who I was, and I didn't know how to do self-reflection. I didn't know how to do all these things. And I'd done yoga in the past in my 20s, and I actually really liked it. And she's like, hey, why don't you go up to this place? It's called Kripalu. People have different feelings about it, but I ended up going there. And during one of the retreats, like we're doing these meditations. I was just like, why is this so hard? Why can people do this? I don't understand. Sitting there, I'm so frustrated. I'm like, why? I was like, I don't understand. This is so hard. I could not sit. And the same thing during the yoga, I'd be like crawling out of my skin because I wanted to stop. I was like, this is so uncomfortable. Not the physicality of it, but the centeredness and the slowness. And what I learned from like yoga and meditation is like, specifically yoga, is how to start being comfortable in the discomfort. I think that's the most powerful thing that I've learned, because I've done a lot of hard things, but I was never like comfortable doing it. It was like I was just like dragging through and like forcing myself and very like, get I'm going to get through this. But like, that was like my life. I was like, I got to get through this. And then what? I got to get through something else. So it was always like this, like in this kind of fight and flight, never arriving. And so like yoga practices, meditation practices actually like help me come to right now and like not try to run away from the discomfort of life, because life is really unpleasant sometimes. And like sitting in it and being like, okay, it's a weird process of like shifting your mentality. Like, this is not happening to me. This is happening for me. And I was just like, what? But it's like, it's sitting there and being like, okay, like as long as nobody's going to die, all right, I'm not going to die. I'm uncomfortable, and being aware, becoming aware as well, aware of this, that I'm uncomfortable, aware of my thought pattern. Cause you're in those postures and you're like, all right, I just gotta be here. And it's just like, it's settling in. It's settling into your body and quieting the mind so you can like be present. And I think for me, like that's how yoga has like brought me to a different place. And that's why I also pass this on to my patients. I still remember I had a bunch of patients where like, these are moms, these are women from Latin America, South America, where they are, they tell me, they're like, I do all the housework, I do all this, I cook for the family, and I work. And I'm like, that sounds like a lot. That's a lot. So, I was like, what if you just did 15 minutes a day? You woke up 15 minutes early and you just did 15 minutes of yoga a day. Month and a half. I had them both come back, obviously different times. And like, they came back, they're like, oh my God, my life is so much better. I was like, oh, they're like, I don't know. I don't know what this stuff is doing to me, but I feel like I have more time now. Like I'm so much more calm. Like I'm less reactive. I feel like I have more time in my life. And I'm like, it's weird, right? They're like, yes, it's super weird. I'm like, nothing's changed except the perception from inside.
So massive. I mean, what a special gift you've given yourself and your cousin, second cousin. Thank you, cousin Matza.
Actually,
And
she's a McAllister. Adrian. Hi.
well, thank you,
Dr.
Adrian.
Adrian McAllister.
Yeah. Well, these lessons, these ancient lessons, and sitting with the discomfort. Life is not comfortable. However, if we can understand that and understand that we don't need to be comfortable at all times or entertained at all times, and we have ourselves, we have this beautiful gift of consciousness and just enjoy the moment. What's something that patients, so speaking of physicians, and you touched on how there's a push to have a cookie cutter type of physician, right? We're all supposed to be the same, and we're all, and physicians are, this is the way you present, this is how you talk. And what's something patients assume doctors don't care about, but actually has a huge impact on how you treat them?
They don't feel like they're cared about, period. They're like, they just don't feel seen, heard, or understood. Like I've had patients where they're like, I make most of my patients cry. I don't make them. I just like say things where I'm just like, well, I wonder if you did this. And they're just like, "Bleh." Because no one's ever stopped to like really see them as a person. You're here for diabetes. You have to work on your exercise. You have to work on your diet. It's like, I'm going to say like 80% of patients know this already. And like, still like, why do you say things the same way all of the time? And like, clearly they're not hearing. Like, again, it's going from here to here. I always ask patients, I was like, okay, so you know what to do. They're like, yes. I was like, then why don't you do it? They're like, I'm lazy. I was like, bullshit, excuse my French, but there's no such thing as laziness. It's made up. It's absolutely made up. And like, I hate that the vocabulary word is in that's here. I was like, you can be tired, you can be resistant, you can be annoyed, you can be angry, you can be this, you can be shameful, but there's no such thing as laziness. And like having patients understand why they do the things that they do is what really it just like kind of you see like things like melting and like some sort of realization. They're like, I'm not lazy. I was like, no. And they're like, wait, but that's what society has been telling me. That's what my parents have been telling me. That's what like I've been telling me. I was like, no. I was like, you have all these parts of you, and somebody is having a very vocal conversation that's making it very physical. Like I had a patient who, she used to go to the gym and then she didn't. I was like, why? She's like, oh, I'm lazy. I'm like, no, incorrect. So like, I started walking her through it. I was like, well, what happened like 2 years ago? She's like, oh, my dad died. Like,
Wow.
and what would happen if you started going back to the gym? And like she felt like she was dishonoring him. She felt shame for going back to the gym. And it's just like I would have never ever in my life thought like my parent died and now I'm not going to go to the gym because I feel shame for taking care of myself. Like, and this is why it's like it's so important to me to like sit there and like think about like I can't assume anything. I can never assume anything why people do the things that people do. Like there's always a different reason. And they always chop it up to laziness. And I'm like, you're not lazy. There's something else. Like what part of you? What part? What part? I do IFS, internal family systems, where it's like you understand there's many parts of you. You have a little 2-year-old and a 3-year-old and a little bitchy teenager. And you have all these parts that have like, they're on your bus. And it's just like, who's driving the bus? And so it's like a really magical thing to really honor who people are and what they're experiencing and allowing them to honor it too. So they can actually do like the best that they could possibly can. I don't know if I answered. I totally had just
No,
had an
you
ADD moment.
absolutely answered it. So part of I was just thinking as why physicians are the way they are, and I've had that experience too, where it's just the physician will come in, and sometimes I think it's a self-protective factor because and also the system that teaches them. I don't know if because I've been through medical school myself, and so the system itself will teach you what's that one saying, which is if you hear hoofs, don't look for zebras, right? And so I mean, there's all these little things that will try to get you into this rubric, and you're supposed to adhere to that, and it's self-protective. So there's like a lot of different things, but I'm glad there's physicians out like you out there listening, because that seems to me a fundamental issue is that people just don't listen, and if you're not heard or don't feel like you will be heard, then why would you even divulge anything more? It's like
Yeah.
almost like a waste of time for them.
Yeah. Patients don't trust doctors.
So you clearly live in your body, movement, nature, embodiment. How has that changed your understanding of chronic stress or pain?
I'm sorry, say it one more time.
Yeah. So just knowing you and your life and things that you've done for fun or your travels, etc. And so you live in your body, you live through your body, and movement and nature, and especially embodiment of your philosophy. How has that changed your understanding of chronic pain or stress?
Wow. That's a really good question. I think because I've lived it and I've transformed it gives me the most understanding that without like I just I think for me, so I was diagnosed with Sjogren's when I was in my 20 in med school. All of a sudden, surprise, med school, I have a autoimmune disorder. So like learning how like which for anybody who doesn't know what Sjogren's syndrome is, it is chronic fatigue, have it pretty much attacks all your glands that secrete things. So like everything is dry. Your brain is dry, your eyes are dry, your mouth is dry, your skin's dry, everything's dry. And so it can have high levels of sleep disturbance, difficulty digesting food. And so all in all, just like a miserable existence. And I feel like I was put on this earth. They're like, oh, we're just going to let her she's just going to experience it. And that's how she's going to become a great doctor. So like, I had chronic pain. I was constantly with insomnia, depression, anxiety, like, and just feeling overall terrible. And, I started understanding how my mind affects me, how my emotions affect me, how the things I eat affect me, and how my past has affected me. Emotions, mental, physical, everything. And so when it comes to chronic stress, it's just going to go from, and I mean, I want to put a caveat here. Not everybody like reacts to stress the same way, right? So, like, if you are little and you have some sort of trauma, you're able to process the trauma. It's not going to get stuck in you, right? Or you have somebody to help you. And so when people have chronic stress and you don't have people helping them navigate, it all gets stuck in here, and then it just starts wreaking havoc because there's no outlet and there's no processing. So it just I call it storage. It just gets put into storage, and then it's just constantly kind of circulating in here and circulating in your subconscious. So it's like you have all these movies playing in the background and all this music playing or whatever else happening in the background, and it just wreaks havoc on the body. And having experienced all that, having an autoimmune disorder, like it came into an awareness, like autoimmune disorders. I caused this because I didn't know. Like, I've been suppressing my emotions. I've been treating my body terribly but it's not a fault thing. I didn't know how. And this is the biggest thing. It's just like when people are not taught how to express themselves, their rage, their anger, their sadness, their grief, it just goes into our bodies. And that can be socioeconomic, that can be familiar, that can be ancestral, that can be societal. Like, it all happens and it comes into the body. And it's like, this is why I tend to always go through the heart when I'm treating patients, because, like, if we don't understand what's happening here, we don't understand what's happening here. So it's like, I mean, like, there's people that get hit by cars and strange traumas that happen, but it's just like, a lot of times with chronic disease, chronic trauma, chronic stress, it always comes into the body. It goes from out here to in here. It's not processed. So it's like put down into storage. And then it's all like in here, and people don't know how to process it. They have no processing plant, essentially, you know? And so it really, and this is why I do what I do, because I'm helping patients set up their own processing plant for themselves so they can do it themselves. Did I answer your question?
Yeah, absolutely. I think what the overall theme I'm hearing is that we're not taught so much of our mind body connection, and because of that, and especially for how when we have unprocessed feelings, typically they have to go someplace, and so how will they manifest? It could be anywhere from emotional problems, depression, anxiety, or phantom pains and these things that we just don't, or real pains. I mean, like, it's all there. And so we're not taught how to process these things. So I'm glad that you're doing that.
Yeah.
Well, I think we focus a lot on our interactions with clients, and very importantly, and very rightly so. But you've worked for how many years now as a physician? So a
Mhm.
decade working as a licensed physician. After working in different healthcare systems, what does a healthy job for a doctor actually look like? Because I've heard so many stories, from physicians about unhealthy jobs. Like, what does a healthy job for a doctor actually look like?
I kind of, know, you have boundaries. Boundaries is what makes a healthy job. And I do something called locum tenens, which is, everybody's heard of travel nurses. It's travel doctoring. And I have found that this is the healthiest way I can do medicine, where instead of, I call it getting married, instead of like signing on the paper and like, I'm going to be with you for 3 years, I sign contracts for 3 months with the option to extend. And if I don't like it, I can give them 30 days. And so for me, this is a boundary that I needed because I don't have the capacity to work every single week except for 4. That doesn't work for me. Like, I need healthy boundaries where I'm going to take 6 weeks off because that's what I need. And that helps me be the best version of myself. And I also don't really do well with bureaucracy. Being places short term, that also gives me that freedom. But I think really having healthy boundaries, and this is coming back to like, do you know who you are? And like, do you know that you need XYZ? And are you implementing that in your job? And I think the toxicity of medicine is that you have a lot of people pleasers coming into medicine. And we're there, we have a mission. Most of us have a mission. We want to do a good job. And then we're brought into this system where it's like, you have to see more patients. We're patient centered. I was like, yeah, but you actually need to be like, person centered. Like, you actually have to take care of your talent. And they already want to do that. They already want to be a good doctor or a good nurse practitioner. You already have a person here that wants to do a good job. You don't have to oppress them by saying you need to see more patients and you need to do this. But they're like, I'm doing the best I can. They're like, you need more. So it's like, it's this cycle of like, administration coming down on physicians, and they're like, you have to do more RUVs and you have to do more of this. And it's just like, what about thank you? Thank you for being here. Thank you for doing this amazing job. Thank you for this. It's just like, we love having you here. Let me show you. And you know, I've been asked to stay pretty much every place I've worked at for the past 3 years. And they're like, well, what stops you? I was like, I have not once been to a place where administration has wanted to collaborate with me. Not one. They want to tell me what to do. Want to tell me when I did wrong or I need to do better. But I've never sat down with somebody to be like, how can we make your life better here? Or like, hey,
Wow.
let's sit down. Like, I really, really love what you're doing. And I'm just like, I just can't do it. I can't be in this like box where people are treated like minions, essentially. And I think this is where medicine has to change. Yeah.
Well, my father, before he worked for 50 years as a physician, he always used to say to me, medicine, it's not the same. And I think there was a time where physicians, it was just different. Where physicians I mean, I think they're respected still in a different way, but I think the systems that have been created around physicians to control them and how what they do, it's just more to convert them into workers rather than healers. And I think that's what you're touching on from what I'm healing. That was like a Freudian slip because that's my next question here. And this is the last one. I thank you so much for speaking with me today. In this current chapter of your life, what does being personally well, or what does being well personally mean to you? Like, not just to you, but like what does being well mean overall to you, perhaps, and maybe to what being well should be or ought to be for most of us?
My brain is going in so many different directions right now. I think it would have to come down to like looking at the different, like, physically well, emotionally well, mentally well, spiritually well, socially well. So it's like, we're multifaceted people. Like, there's so many parts of us that need to have attention. And I think making sure for me personally that I think it's like being purposeful about the things that I do for myself. Because with my neurodiversity, I have a hard time doing that. And so it's just like I'll be like doing well for a while, and then all of a sudden I was like, wait, where am I? And so it's like coming back to like, all right, I had like start like trying to get rituals to the best I can that can speak to my brain and that are like kind of going on each of these levels of me. Like, how is my heart? How's my emotions? How's my mental? How's my career? How's my relationship? How is my body feeling? I think having that awareness and trying my best and to work on each of these parts of me, I think that is the best way I've I've achieved wellness, and also having the willingness to forgive myself when I'm not being perfect with my wellness. I think that's probably the hardest part.
Wow. Well, Dr. Matz, it's so fascinating, and I appreciate you so much for taking this time. How would people, I want people to connect with you, and how would people, if they can, and obviously your philosophy on healing is, I mean, it sounds wonderful. How would people connect with you to see you on a professional level?
Um, well, it's kind of hard sometimes because I'm traveling around so much, but I do have an Instagram. A lot of my patients follow me. My old patients follow me. It's Dr. Kathryn Mazza, and yeah, you can always like come say hello, and I'll say hello back. We can have a conversation.
Excellent, excellent. Well, I hope you have a wonderful rest of your holiday, and you're taking some time off,
Yes,
and you eat lots of good
absolutely.
food, and you just enjoy.
Gonna do Chinatown this week. This
That's right.
today.
That's right.
Yeah.
It is Chinese food day. Okay, well,
Yeah.
thank you so much, Dr. Matza.
My pleasure.